Hi, good morning. I, Padma Salim, today will describe or explain what is amnesia. Amnesia is a form of memory loss. Some people with amnesia have difficulty forming new memories, others can't recall facts or past experiences. People with amnesia usually retain knowledge of their own identity as well as motor skills. Mild memory loss is a normal part of aging. Significant memory loss or the inability to form new memories may indicate the presence of an amnestic disorder. It is a condition in which memory is disturbed or lost to a greater extent than simple everyday forgetting or absent mindedness. In simple words, it is a memory loss. Symptoms of amnesia. The primary symptoms of amnesia is memory loss or inability to form new memories. If you have amnesia, you will have difficulty recalling facts, events, places, or specific details. You will still retain your motor skills, such as your ability to walk, as well as fluency in any languages you speak. There are two main causes of amnesia: functional or psychogenic cause, organic or neurological cause. Functional or psychogenic cause are psychological factors such as mental disorder or PTSD or psychological defense mechanism. Organic or neurological causes includes damage to the brain through trauma or neurological disease or use of certain generally sedative drugs. Other causes of amnesia can be lack of proper nutrition or malnutrition, tumors in the brain, especially in those parts which control the memory, epilepsy when not treated on time, damage to the main areas or vital areas of brain functioning or processing, stroke, lack of sufficient amount of oxygen reaching to the brain, usually in early years of life. The usual cause of amnesia are lesions to the brain from an accident or neurological disease, but intense stress, alcohol abuse, loss of oxygen or blood flow to the brain can also be a cause of amnesia. And sometimes the treatment known as electroconvulsive therapy can also be the cause of amnesia. For example, intense stress can cause the sympathetic nervous system to activate the adrenal glands, which secrete certain hormones into the bloodstream and affect the plasticity of brain's neuron, their ability to change and strengthen connections, especially those in hippocampus. Hippocampus, which is solely responsible for making memory. The main two types of amnesia are retrograde amnesia and anterograde amnesia. Retrograde amnesia is the loss of ability to recall episodic memories and many times semantic memories that happened before a brain injury occurred. Retrograde amnesia tends to be strongest for memories that happened just before the brain injury event. For example, a person who sustains a serious consciousness during an automobile accident may not remember anything about his or her life for several days prior to and including the accident. Retrograde amnesia refers to an ability to retrieve memory of the past. It can also be caused by more severe brain damage, or it can be caused by a head injury or any emotional trauma. Mainly, retrograde amnesia focuses on the loss of old memories. Anterograde amnesia is the loss of ability to form new episodic memories and many times somatic memories after a brain injury occurs. That this also includes the onset of neurological disorders such as Alzheimer's disease. Anterograde amnesia significantly and negatively impacts a person's quality of life. The inability to form any new episodic memory renders a person to live in a perpetual now state. live in the living or present current state, where new events are never remembered. It refers to mainly no post-trauma memories are formed. Further types of amnesia refers to post-traumatic amnesia that is usually due to a head injury and is often a temporary. Dissociative amnesia refers to usually psychological rather than physical, can be a repressed memory. Child amnesia or infantile amnesia, not it refers to not being able to remember events when you were young, which is normal, possibly related to not having language skills yet. Drug-induced amnesia, it is usually caused unintentionally, like during surgery or a medical procedure. And source amnesia is inability to remember how you obtained knowledge or skill, but still knowing or being able to do. Now we should focus on the treatment of amnesia. To treat amnesia, your physician will focus on underlying cause of your condition. For example, amnesia from a mild head trauma usually resolves without treatment over time. Amnesia from severe head injury may not recede. However, improvements usually occur within 6 to 9 months. It depends, treatment of amnesia depends on the cause. What was the really significant cause of amnesia? Now let's take a quick view overall summary of amnesia. It is a mental condition that affects one's memory. There are many causes, several causes, but the most common reasons is physical injury, post-traumatic stress disorder, or damage occurs to the brain, vital areas. Main types of amnesia are anterograde and retrograde. Anterograde amnesia includes the inability to remember or memorize new events or data. It focuses more on short-term memory, and one with anterograde amnesia generally keeps their long-term memory intact. Retrograde amnesia is when someone is unable to recall past, long-term memories. They may, for example, forget their childhood after a traumatic car accident that causes damage to their brain. Both can be temporary or permanent and should be monitored by doctors. There are also blackout phenomena. Blackout phenomena refers to one falls into an amnestic state after excessive alcohol use, and there is also amnesia that can be caused by drugs. So, drug induced amnesia is more of an intentional cause of amnesia, where amnesic drugs are injected into a patient that is undergoing certain medical procedures or surgery and are given to help the patient forget certain traumatic experiences that cannot be performed under general or full anesthesia. So, I hope this video and presentation would help you in uh, forming a clear understanding regarding amnesia. Thank you.